rhinoplasty, it's a centerpiece of our face, and there's so many subunits to the nose that all have to come together in harmony to create a nice looking nose. So during the healing process, one of the subunits might be a little bit more swollen than another part, and that can lead to asymmetries, deviations, and so forth. And that's a pretty expected course post-operatively for almost every patient. What we want is a nice, natural, harmonizing nose in the long run. So the nose, on average, will take at least a year for it to completely react from a rhinoplasty surgery, specifically tip work. So everyone heals very differently. The technical aspects I'm confident with for each and every one of my patients I operate on, but where we haven't really perfected yet is how every person can heal a little bit differently and react a little bit differently from the surgery. So I kind of describe this on a kind of a normal distribution scale. So some patients are super fast healers, and those are the outliers where they walk in 1 month later and are looking phenomenal. Those are outliers, and I hope that for every one of my patients. But most patients who go through this surgery, they're looking good at around 4 weeks to about 2 to 3 months after surgery. So that's kind of the bulk of the patients that go through this type of surgery. And then there might be some slower healers that are on the other end of the distribution that might be a little bit of slower healers. And those are patients that might still have some stubborn swelling, even at 6 months and longer. So we tell patients that don't have a crystal ball to know how exactly you're going to heal, but it's something that we follow patients and want to be along with during that whole process so that we can monitor and sometimes intervene with some basic things that we do in the office, like massage techniques or sometimes some steroid injections that are necessary. But that's a critical part of the healing. And ultimately, the outcome is to maintain that dialogue with the patient and the surgeon so that the end outcomes are achieved for everyone. So really we want to hit that end long-term outcome for everyone.